All right. So while performing an operation in the area of axillary crease, a surgeon has to define an arterial vessel surrounded by fascicles of the brachial plexus. The brachial plexus. What artery is it? Even if you don't know at all, by virtue of your anatomy, if they are talking about the axillary crease, definitely, one thing about anatomy is that names correspond to, names of vessels or names of tissues correspond to the area in which they are located. Okay, so if you are doing an operation on the axillary crease, definitely you should be looking at what? The axillary artery. The axillary artery. And this axillary artery is a very large blood vessel that conveys oxygenated blood to the lateral aspect of the thorax, the axilla, that is the armpit, and then the upper limb. Again, this anatomy. So I will entreat you, and of course, it comes from the brachial plexus, isn't it? So you need to find time and then get to understand the anatomy of or the passage or where it passes exactly. Unfortunately, because I didn't plan for it, I should have shown you a diagram or something like that. But unfortunately, we don't have that diagram. So over here, you must understand this is what axillary artery or A axillaris. So your answer is C, axillary artery. Why? Because of the operation is at the axillary crease. The axillary crease. All right. Examination of a patient with impaired blood coagulation. When we say impaired, that means inability to coagulate blood or inability to clot. Okay, so they are saying that examination of a patient revealed an impaired blood coagulation, which revealed what? Thrombosis of a branch of inferior mesenteric artery. Inferior mesenteric artery. What bowel segment is damaged? So over here, you need to know the branches of the inferior mesenteric artery and which organ or which intestine it supplies. So the inferior mesenteric artery has the following branches. We have the left colic artery, we have the sigmoid artery, and then we have the superficial rectal artery. Therefore, looking at what I'm talking to you about, left colic artery, the sigmoid artery, then the rectal artery. So from the option that we have here, our best bet should be what? The sigmoid. So and of course, like I said, names of arteries correspond to the name of what organs, isn't it? So we're talking about the sigmoid artery being damaged or there's a problem over there. It means that it will definitely affect what? The sigmoid colon or that part of the intestine. So your answer should be what? Should be A. Your answer should be A. All right. A patient was admitted to the surgical department with inguinal hernia. Again, hernia is just a protrusion from the abdomen due to a weakened abdominal wall. So the content of the intestine begins to protrude. So during the operation, the surgeon performs plastic surgery on the posterior wall of the inguinal canal. So what structure forms this wall? Again, to answer this question, you need to know the walls of the inguinal canal. So let's take a moment to know the walls of this inguinal canal. So anteriorly, I hope you are writing. So anteriorly, we have the aponeurosis of the external and internal oblique. Again, anteriorly, we have the aponeurosis of external and internal oblique. These are there. So aponeurosis of external oblique will be what? Anterior. Good. Then we have posterior. We have the transverse fascia. So this is what? Posterior. This is arterial. This is posterior. Then superiorly, we're having the internal oblique and the transverse abdominis muscles. Superiorly, we have the internal oblique and then the transverse abdominis muscle. So over here, this perhaps might be a superior one, might be the superior one. Then inferiorly, we have the inguinal ligament. Inferiorly, we have the inguinal ligament. So from the options that we have over here, and they are talking about the posterior wall, we are saying that the posterior wall is made up of what? The transverse fascia. The anterior wall is made up of the aponeurosis of the abdominal external oblique. And then inferiorly, we have what? The inguinal ligament. Then superiorly, we can have the transverse abdominis muscles. So please take note of these things. So if the question comes and they ask for anterior, you know what to do. They ask for inferior, you know what to do. So don't come and tell me that you don't know it and it's a new question. It's not a new question. It's the same question, but they've been twisted. All right. So your answer is B. Your answer is B. All right. A man with an injury of the dorsal area of his neck. The dorsal area of his neck. So if I were you, I'll just put my hand on my neck. Put your hand on your neck. Yes. Exactly where you have put your hands on. That's what they're talking about. The dorsal area of the neck was admitted to the resuscitation department. What muscle occupies this area? Now, if you look at the dorsal surface of your neck, mostly it is made up of what? Trapezius muscles. Trapezius muscles. Trapezius muscles. A lot of them are made up of the trapezius muscles. So over here, your answer should be what? E. Trapezius muscles. Trapezius. Trapezius. Okay. Again, dorsal means the back of your neck, just to add up. Dorsal means the back of your neck. So when I ask you to put your hands on your neck, definitely, I know most of you put it at the dorsum or the back of your neck. And that place is made up of what? Trapezius muscles. So the answer is E. A patient complains of dizziness and hearing loss. So this has to do with what? Hearing. What nerve is damaged? Definitely, you know the nerve that is responsible for hearing and balance is what? The vestibulocochlear nerve. The vestibulocochlear nerve. And this is found in the inner ear to the brain. So where you are looking at what? The vestibulocochlear nerve. Vestibulocochlear nerve. Okay. The vestibule is in the ear. So don't forget that. Vestibulocochlear nerve. While palpating mammary gland of a patient, a doctor revealed an induration in the form of a node. There's an induration in the form of a node. So this can be a lump. This can be a benign tumor. This can be cancer too, isn't it? So there's a what? An induration in the form of a node in the inferior medial quadrant. Guys, look. Metastasis may extend to the following note. Now, talk about metastasis. This means that it can move and affect other tissues. So that means that whatever node that is there is a cancerous node. It is what? A cancerous node. A cancerous node. So this patient could have what? A breast cancer. This patient could have a breast cancer. Now, local metastasis of breast cancer are usually to the lymphatic nodes of the breast base, the axilla, the subclavicular, the parasternal nodes. Parasternal node. And the distant metastasis will enter into the bones, the lungs, and in the liver. Again, for local metastasis or local movement of this cancer to those places include what? The breast base, the axilla that is around the armpit, the subclavicular, and then the parasternal nodes. parasternal node. Then for distant, that means far organs, it's metastasis to the lungs, the bones, and then the liver. So from what I've just mentioned, of course, metastasis, the more appropriate one in this one would be what? The parasternal nodes, parasternal node. But it can also be in the axilla, the subclavicular, the breast base, the bones, the lungs, and even what? The liver, and even the liver. But first, it must enter the local places, which will be what? Parasternal lymph node, parasternal lymph node. All right. A patient got a trauma that caused dysfunction of motor centers. It caused a dysfunction of motor centers regulating activities of the head muscles. Regulating activities of the head muscles. Now, in what part of the cerebral cortex is the respective center normally localized? Is the respective centers normally localized? So what I'm trying to tell us is that they are saying that motor functions are disturbed. Motor functions are disturbed. So it's up to you to know which part of the brain discharges or has the motor centers. Which part of the brain? And of course, the primary motor center of the cortex is called the precentral gyrus. Again, the primary motor center of the brain or the cortex is the precentral gyrus. The precentral gyrus. And of course, it will control a whole lot of things in the head muscles and everywhere in the body. So over here, we are looking at what? The precentral what? Gyrus. The precentral gyrus. Precentral gyrus. So your answer here is what? Is A. Is A. I mean, the inferior part anyways. The inferior part. The inferior part. Now, basically, the lower part, okay, the lower part, the lower part of the body, guys, add this one to it. The lower part of the body are represented in the lateral surface area. I repeat, the lower part of the body. So your lower part of the body, it is the lateral surface of the precentral gyrus that is in control. Okay, the lateral, which could be upper and superior. The upper and superior, upper and superior. So if you go for superior, that means you are going to think of what? The lower part of your body. Now, the upper part of your body, which include the head muscles, is controlled by the inferior surface of the precentral gyrus. The inferior surface of the precentral gyrus. So please take note of that. Take note of that. And of course, supramarginal gyrus basically deals with what? With your learning process. Learning process. Your learning process. That's the supramarginal gyrus. It deals with learning. All right, that's just by the way. So over here, your answer is what? Is A. Is A. Examination of a 6-month-old child revealed a delay in the closure of the occipital fontanelle. You know, normally we have the anterior and then the occipital. So the occipital fontanelle, when is this supposed to close normally? And your answer is what? Until 3 days. Until 3 days. Then the anterior fontanelle is supposed to be closed 7 to 18 months. I repeat, posterior fontanelle is supposed to be closed by the time of 2 to 3 months, whilst the anterior fontanelle is supposed to be closed by 7 to 18 months. 7 to 18 months. So in Krok, if they don't say occipital and they bring anterior, please don't be lost. Don't be lost. It is 7 to 18 months. All right. So 6 months, obviously, it is delayed. So answer is A. A patient was diagnosed with paralysis of facial and masticatory muscles. Hematoma is inside the genome of the internal capsule. What conduction tract is damaged? What conduction tract is damaged? is damaged. Now, the muscles of the face, the head, and then the neck, I repeat, the muscles of the face, the head, and then the neck are controlled by corticobulbar system. They are controlled by the corticobulbar system. Corticobulbar system, which of course will terminate in or within the brainstem. It terminates within the brainstem. So again, we are talking about corticobulbar system. Corticobulbar system. And of course, if you're talking about corticobulbar system, then definitely our best bet will be corticonuclearis. 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 All right. So your answer is what? Is D, corticonuclearis, because it's the same as what? Corticobulbar. Corticobulbar. All right. So your answer is D. A patient has lost sensitivity in the region of the medial aspect of the shoulder. So if I were you, I'll just put my hands on the medial aspect of my shoulder. So basically, they just say around your armpit area, isn't it? That would be the median aspect of your shoulder. The median aspect. Now, this is the result of dysfunction of the following nerve. Dysfunction of the following nerve. So, at the medial aspect of the shoulder, what comes to mind? Of course, you are thinking of what? The median brachial cutaneous nerve. The median brachial cutaneous nerve. The medial brachial cutaneous nerve. And this is a branch of the brachial plexus. This is a branch of the brachial plexus. Okay, which arises from the median cord of the brachial plexus. It arises from the median cord of the brachial plexus, and it supplies the skin of the median area of the arm. It supplies the skin of the median area of the arm. That's why the patient has lost skin sensitivity in that area, because what is supplying in it has a dysfunction. So over here, we are looking at what? At the median brachial cutaneous nerve. Now, if you talk about antebrachial cutaneous nerve, that one supplies the anterior median area of the forearm. Don't forget, the difference between arm and then forearm. Your arm is from your shoulder to your elbow. That is your arm. Your forearm is from what? From your shoulder down to your hands. That's the forearm. So if you talk about the median brachial cutaneous plexus, it is supplying the anterior median area of the forearm, whilst the brachial cutaneous nerve, the median brachial cutaneous nerve, it supplies the what? The skin of the median area of the arm. Okay, so over here, you answer definitely what? D. All right. A foreign body, closed space of the right superior. A foreign body, that's like a button, closed space of the right superior lobar bronchus. What segment of the right lung won't be supplied with air? What won't be supplied with air? So there's a foreign body. So the question is, where is it going to what? To affect the most? And definitely, you know that when you ingest or when you aspirate a foreign body, it normally enters into your right lungs. Your right lungs. So when it enters into your right lungs, that means that part will suffer, or some part of it will suffer. So what are these parts? Usually they enter into the superior lobe. They normally enter into the superior lobe. So anytime there's a foreign body aspiration, check the superior lobe of the right lung. Check the superior lobe. And then the superior lobe of the right lung consists of three segments. It consists of three segments. These are the apical, the posterior, and the anterior. Again, the apical, posterior, and anterior. So Yima and Faustina, you guys should get a picture of what I'm talking about. Talking about the lobes of the lungs, the superior lobe, and the demarcations, or the segment that are found in the superior lobe. Get it and put it on the group page. So over here, we're looking at what? The apical, the posterior, and the anterior. So your answer is D. Your answer is D. All right. A patient was diagnosed with Bartholinitis. The ladies will understand this better. That's what inflammation of the greater vulvovaginal glands. Okay. In which organ of the urogenital system are these glands localized? In other words, where can you find this Bartholin's glands? Where can you find it? And they are found on the large lips, or the labia majora. You guys know majora. That are the lips, the labia majora. So you're going to look at what? The large lips of the pudendum. It's not saying labia majora, or the greater lips. All right. Don't worry, if you're a guy, you might not know what I'm talking about, but the ladies, for sure, know what I'm talking about. It is just like a flap that closes the vagina, like a flap. All right. So your answer is what is C. While performing an inguinal canal operation, guys, inguinal canal has come again. On account of hernia, a surgeon damaged the canal's content. What exactly was damaged? Guys, so inguinal canal, definitely what substances passes through there? Of course. We're going to talk about what? The funiculus spermaticus, or the spermatic cord. It is passed there. And those are one of the few things that we get worried about. Usually it is found in men. So this person is a man or it's a guy. Because ladies don't have spermatic cords, please. This is referring to a man. So please take note of that. So you're talking about the spermatic cord. And of course, there are some other nerves that passes through it, like the ilioinguinal nerve. It also passes through the same canal, ilioinguinal nerve. And then in females, we have the round ligament of the uterus. And the ilioinguinal nerve. So if this was to be a female, then of course they would have brought what? The round ligament of the uterus, because that is where the canal, it passes through that canal. So over here, we're looking at what? We're looking at A, the spermatic cord. All right. Ultrasonic examination of a patient revealed aneurysm. That's like a distension, okay? Distension, like widening of a vessel, in this case, the aorta. So there's revealed aneurysm in the area of the aortic arc that caused alteration of vocal function of the larynx. So what nerve was constricted? So if there's a compression on the larynx, so you ask yourself, what nerve is found on the larynx? That can even lead to a change in voice. Of course, you are thinking about the recurrent laryngeal nerve. Anytime there's a tumor in the throat, it affects this recurrent laryngeal nerve. So over here, we're looking at what? The recurrent laryngeal nerve. So over here, your answer is A, recurrent laryngeal nerve. Surgical approach to the thyroid gland from the transverse approach. Involves opening of interaponeurotic suprasternal space. What anatomic structure localized in this space is dangerous to be damaged? Again, we are talking about the collarbone. So surgical approach to the thyroid gland. You know what a thyroid gland is, right? So you just place your hand on your neck, in front of your neck. Place your hands around the area. Yes, exactly somewhere around the area, you will find your thyroid gland. And they're saying that they want to make an approach from the collar. In other words, around your neck, around your neck area, around your neck. That is what they want to make the transverse incision, whatever they want to do. So the question is, what structure is there that can be damaged? And of course, you are looking at what? The jugular venous arc. The jugular venous arc. And this is just above the sternum. It is just above the sternum. Just above the sternum. Good. So you want to be careful because of what? The jugular venous arc. And of course, it gives rise to the inferior jugular vein. All right, so here we're looking at what? At B, jugular venous arc. Why? Because of where they want to make the transverse incision from. That's around the collar, the collarbone. All right, and over there we have the venous arc. So answer is B. In the course of a small pelvis operation, it became necessary to ligate an ovarian artery. Ovarian artery. What formation may be accidentally ligated together with it? And if, guys, you must know that. So they want to ligate the ovarian artery. They want to ligate the ovarian artery. But you must also understand that now in females, how do I put it safe? Good. So you must know that when we talk about the pelvis is a part of the kidney. Okay, that is where urine that are collected are now drained, isn't it? And then they drain via the ureter into the bladder. So from the pelvis, we have the ureter, then into the bladder. And sometimes when you're doing a surgery and you don't take care, you might end up ligating this ureter because they one way or the other move hand in hand with this ovarian artery. So they move alongside. So if you don't take care, you might mistake the ureter for the ovarian artery. And that can be a very difficult thing to deal with, if you ask me. So over here, we're looking at what? At A, the ureter. The ureter. All right. An injured person was delivered to the hospital with a penetrating wound in the left lateral region of the abdomen. What part of the large intestine is most likely affected? So guys, I don't know if you know this, but assuming this is your abdomen. Okay? Assuming this is your abdomen, you know that usually the abdomen is divided into into 9 equal parts. It's divided into 9 equal parts. So this is your abdomen laterally. So this is the epigastric area. Let me just use the epigastric area. This is the right upper quadrant or the right hypochondrion. The right hypochondrion. This will be the left. This will be what? This one here will be the umbilicus, isn't it? This one will be what? The umbilicus. Then we have what? The right lumbar area, left lumbar area. Then we have what? This epigastric. This one here would be the hypogastric. Then it will be what? The right iliac area, left iliac area. So as a human being, this is how your abdomen is divided. And at every point, there are some organs over there. Now the question says what? There's an injury penetrating wound in the left lateral region of the abdomen. So we talk about the left lateral region. They're talking about what? This place. They're talking about what? This area. Talking about this area. Oh. Talking about this area. Sorry, they said left. So it is here. This is right. This is left. Sorry. So this will be what? The left area. Here. This is the left area. The left area. So you ask yourself, what organ can be found in this left area? What organ can be found in the left area? And basically, you are looking at what? At the descending colon. Descending colon, you're looking at the left kidney, the left ureter, the loops of the small intestine. These are the organs that you can find over here. And of course, you can even, to some point, you can get the pancreas, the spleen. To some point, you can get part of it are found over here. But of course, majority of it is found up a little bit up there. So you must know these things. You must know these things. So over here, you're looking at what? Definitely looking at what? Your descendant colon. So the answer is what? Is A. Is A. If it were to be right, then of course you are thinking of what? The ascending. If it were to be the umbilical area, then you can think of what? The transverse. The transverse. If it were to be what? The right iliac, then you can think of what? The cecum. The cecum. Or the caecum, if you want to pronounce that way. So over here, answer is A. Please take note of that. After a road accident, a driver was delivered to the hospital with an injury of median epicondyle. Median epicondyle. Median epicondyle. What nerve? What nerve? Now, the median means that this is found at what? The ulnar area. The ulnar area. And when you look into your palm, just turn and look into your palm and straighten your hand. Exactly. So the median epicondyle is check how do you call it? The elbow joint. Okay. Check your elbow joint. That protuberance or that extension of the bone in the, how do you call it? In the cubital fossa, medially or to yourself, that area, you see a protruding. That place is what, part of it is what the epicondyle is about. Okay, so the median aspect of it. So that means that, and over there too, that is where the ulnar nerve passes. That is where the ulnar nerve would pass. So an injury to that place would definitely lead to what? A damage to that nerve. So your answer should be A. Your answer should be what? Should be A. All right. A patient with a knife wound in the left lumbar part was delivered. Guys, you see, the left lumbar part was delivered to the emergency hospital. In the course of operation, the surgeon found out that the internal organs were not damaged. Wow. But the knife injured one of the muscles of the renal pelvis. The renal pelvis. So what muscle is it? What muscle is it? And over here, you are definitely going to look at what? You're going to look at for the muscle that is protecting the kidney. Okay. And of course, you are looking at the greater psoas muscle. The greater psoas muscles. Greater psoas muscle. And this is a fusiform muscle that is located on the side of the lumbar region of the vertebral column. Okay. It is located on the lumbar region of the vertebral column and the brim of the lesser pelvis. Of the lesser pelvis. So that is why over here, when there's an injury to that place, the kidney might be affected. The kidney might be affected. But of course, this patient was very lucky because he was being protected by this muscle. So your answer is what? Is D. Your answer is D. All right. A 25-year-old patient was examined by a medical board. Examination revealed pathology of the chest, okay? Transverse dimensions were too small and the sternum was strongly protruding. So if you have a protruding sternum, that means the sternum is too out, okay? That's what they call it. Like a pingent chest. And that means that if your chest is like that, if the person's chest is like that, this is also called what? The kellied chest. The kellied chest, or the pingent chest. And this is a malformation of the chest characterized by a protrusion of the sternum and the ribs. Now, in a funnel chest, there is a structural deformity of the anterior thoracic wall in which the sternum and the rib cage are shaped abnormally. They are shaped abnormally. And to be fair, it is sunken. So a sunken appearance of the chest is what we call the funnel chest, the funnel-shaped chest. Then we now have what? The barrel chest. This refers to an increase in the anterior posterior diameter of the chest wall, resembling the shape of a barrel. And it's most commonly associated with emphysema. Again, the barren chest is when there's an increase in the anterior posterior diameter. So when there's an increase in that means that it is filled with too much air. So you become, I don't know, but like a barrel. That's what the name comes from, like a barrel. Okay. So there's hyperventilation or hyperinflation in the chest. They become very bulgy because of what? There's an increase in volume. Why? Because of what? Air is not able to go out of the lungs. So they keep accumulating and it makes you quite big to some extent. So what you're looking at what? At the kellied chest or the pinging chest. Why? Because the sternum are protruding. All right. A man with a stab wound in the area of quadrilateral foramen applied to a doctor. Examination revealed that the patient was unable to draw his arm aside from his body. That means abduction was impaired. Abduction. So what nerve is involved over here? Again, we are looking at what? The deltoid muscles. The deltoid muscle is involved in all of these things, abduction and adduction. They are involved in all of these things. So when that muscle is impaired due to insufficient supply of artery or nerve or impulses from the axillary nerve. So that nerve could be damaged, the axillary nerve, because the axillary nerve supplies the deltoid muscles. We've done it before. I think yesterday, 2 days ago, we dealt with the deltoid muscles, which is involved in what? In abduction. All right. Brain tomography revealed a tumor in the region of the red nucleus. There's a tumor in the red nucleus. The question is, where is red nucleus located? Of course, it is found in the midbrain. As simple as that. So over here, what part of the brain will be damaged? Of course, the midbrain. So your answer here is what? Is E.